I have Dr. Matt Steinberger here with me, a hospitalist with Holland Hospital. I know we briefly had talked about some of the surges we've experienced, and I know, I guess in the start of summer, there was somewhat of a spike. Can you talk about that and what that means for us now?
So the spike earlier in the summer and then again earlier in the spring before that is related to the Omicron variant, and then later in the summer, what we just saw was related to the BA.5, which was a subvariant of the Omicron variant. These variants are kind of part of the natural progression of the virus. Symptoms are similar. They include headache, fatigue, fever, cough, shortness of breath, and upper respiratory symptoms like stuffy nose.
What are some of maybe the latest developments in vaccinations? I know that is one of the biggest things that is encouraged to help prevent COVID. What are some of those recent updates?
COVID vaccines are still encouraged for all adults who are eligible. This fall, we should have available what we call bivalent vaccines, which will cover the Omicron variant as well as previous variants of COVID, which are still shown to be effective in preventing severe disease.
Dr. Steinberger, is it possible for someone to get COVID and not know that they have it?
You could certainly get COVID and not know it. Some people are asymptomatic, and on previous variant studies have shown up to 35% of people are asymptomatic.
Dr. Steinberger, is COVID something that everyone will get?
It's tough to say if everyone will get COVID, but certainly everyone will be exposed to COVID. So it's important to still take measures to protect yourself. Things like wearing a mask when you're out in public, hand washing, and if you're eligible, getting vaccinated and being updated on your vaccines.
Dr. Steinberger, is it possible for people to get reinfected?
It is certainly possible to get reinfected with COVID. Typically, if people are reinfected with the same variant of COVID, it's generally less severe, but not always. The best way to protect yourself continues to be vaccination, hand washing, and wearing a mask in public, kind of like we talked about earlier.
Thank you, Dr. Steinberger.
Thank you so much.